as we go through the various lessons, as in each of these videos, we highlighted many times the vision seminar or the vision workshop. And the question got posed to us, if there is a church abroad and they have partnered with a local church in one of the communities that's going through Purpose-Driven, the Peace Plan, what's that early engagement, particularly as it relates to care for the sick?
Right.
How do those initial communications start happening, and then how does a vision seminar happen? So we wanted to highlight those steps, and you are the champion of this. So tell us some of the early steps on how an engagement would work between sister churches.
Thank you very much. Before even getting to the vision seminars that we've been talking about, the Health Vision Seminar, there are a number of steps that are very important to be followed up as far as getting engaged locally there is concerned. And you are going to get in the country as a church, coming to support a church, but it's important to follow important steps. Otherwise, you may find yourself in a situation where you kind of left behind important people who, and I'm talking here about the leadership of the church, but this time at the national level. So your first step is going to be meeting the national leadership of the church. And in most cases, the churches are organized in different levels, and there is a leadership at different levels. So you meet with the national leadership of the church. They assign you, or they send you to the region where the need is, and where you're going to partner with the local church there to do the work. And once you've been assigned the region where you're gonna help the local church to do the care for the sick, you go to the area and you meet the leadership, and that's the first step. Once you are there on the ground, you meet with the leadership of the church.
I was going to say that this, depending on the country you're going to, there's obviously been some purpose-driven foundation in place, peace leadership. There's a sensitivity to make sure that communication is very open, both just for the reasons for being there, but also culturally, make sure everyone understands the process, and that you're invited. So I think the touching base with whatever leadership system is in place to engage at the national and then the local level, be respectful of all of those levels.
Absolutely.
And make sure that everyone knows what's going on.
Very important, and you are going to get important insight at all of those levels in terms of orientation and guidance on what needs to be done. So the third step is going to be to have a discussion locally there on what help is needed. Now, you have in mind what you're going to do, but the local guidance and orientation is very important. And during this first meeting with the local church leadership, you start the discussion on what the problems are. They may have a clear idea on what the health problems are in the community, or need more inputs from the local clinic, and that's going to be, you will get there during the vision seminar because they will be invited. So, but from the beginning, from these very first meetings, you have you have an idea on what the problems that needs to be tackled are.
I would add on at the local level in particular, but throughout all of this, take your time, build relationships. Many of us from other countries have a certain speed. It can be very new. This whole engagement can be very new. So it is more important to build that relationship, to encourage and engage, than it is to quickly come to a decision on, here's what we're going to do first. Really have those conversations and get to know the community, the culture, and have them invite you to participate in these next steps and what they think is going on. Always be listening more than speaking. So
absolutely, very important. So now you've been received by the local church leadership. you've learned briefly about the problems that you're going to support the local church address. And then the local church leadership is going to organize the vision seminar. You are just there as facilitators.
Church-centric, right?
It's church-centric. And then the local church is going to invite the local clinic, the local government leaders, and mobilize volunteers to come participate in this very important meeting, and that is the vision seminar. It's where all the points are going to be discussed, and this has to be successful for the rest of the trainings and the activities to go through. And the vision seminar itself is a half day. It can be a full day workshop with all of these three stakeholders. And it started. It started by the local church leadership, where the committee or the leadership introduces all of the participants and introduces you to the rest of the stakeholders as a friend of the church or a partner of the church or church members.
We're just all part of the same church, right?
Other members of the body of Christ coming to help out. And and the discussion is going to start with the presentation of what the health problems are in the community. And this is generally done by, go ahead, Doctor.
I was going to say, just to interrupt for a moment, there may have been several meetings at just the church level, even before you've gone to invite for this vision seminar.
Right.
And what you're just breaking into now is what does the church see as opportunities, and what can the church engage in? Now we're bringing in other expertise partners in the community to also offer education on based on the numbers or the burdens that they're seeing. So it's very educational, just to an eye-opening, both for the local church and for those that may be attending from abroad.
Right.
What the local leadership is seeing,
right,
and engaging the church in. Perhaps we can come to some sort of solution. Maybe there's something we can do.
Right.
So please continue.
So you understand that you, as the church coming from abroad, from the U.S., you've not yet even seen. You are not yet seen even, because it's the local church taking the lead up until this level. It's the leadership of the local church announcing even the purpose of the meeting, the purpose of the workshop. That's an opportunity for all of us to discuss about the health problems that we are facing in the community, and see how we can use all the resources that are available to address them.
And I would say that as being invited into the local church from anywhere, or even locally, we want to especially focus on empowering that local church as the leadership. That they are the ones who are running and conducting this vision seminar.
Right.
We're coming in to learn more and be of assistance and partner, just like the health clinic or the local government. So go ahead.
Then the local clinic representative is invited to present some facts. What's going on? And it's an important discussion where the main causes of morbidity and mortality at the local clinic are presented. And generally, from our observation, it's everyone who's surprised to see what the problem is, and based on numbers. And it's, again, the same show strategy. So do you see what's happening here, and what can be done, and does this happen? So everyone discovers what the problem is. Okay. And yes,
walk us through the day. Walk us through a half day of vision seminar.
Right. So we are there already. So the introduction has been done. We are in the vision seminar session or workshop, introduction, presentation of the health problems in the community, and comes an important time when the church acrostic is presented. And generally, it is the peace team, or, well, I shouldn't use the word peace team, but it's the members of the church coming from across who introduced this notion.
You're teaching that acrostic, right?
Right. You're teaching that acrostic. And at this occasion, you're not very detailed. You give the very basic of what the church acrostic and strategy and model means. And you divide, and that's the next step, you divide the audience in small groups.
Okay.
And the small groups start thinking on what can be done for these problems that were presented us by the clinic. Inspiring us, or using the church model as it has been presented to us. By following the church model, what can be done to address or support the clinic in its daily efforts to address these problems that have been presented. And after the small group work, after they've done the work and found or a list of number of things that can be done,
ideas.
They come back and share with the entire audience. Each group presents, here is what we found that can be done by the church, following the church acrostic, to tackle these problems. Now, as the facilitator, as the partner, the church, you are going to, or the how can I express this? So, as invitees coming to support the church, take their findings and locate them under each letter of the church acrostic. So this group has found this. Where do we put this? This falls under help with medication. So do we need a bank account to do this? No, we can do this, we can do this. So locate the findings of small working groups under the church acrostic. And everyone gets generally surprised that, oh, we can do the church and solve the problem. So the next step is then to set up goals after the workshop and say, what's next? What do we need to do this? Well, some of the things need really some of the action that can be done after is found by the small working group need some prerequisite, like basic education. And that's where is going to come the role of trainers, or the role of the module on malaria, HIV/AIDS. On how to do this, people need to learn a little bit and understand what HIV/AIDS means and how can one get infected. One needs to learn more about how to prevent malaria or the importance of immunization.
Go through the lessons
Go through the lessons.
based on what they've discovered.
Right. Now, this is not happening the day of because we having here a half day. So, but we have identified the areas that need some equipment in terms of training. And it's going to be the role, and that's the next step, for church leaders to go back and find, mobilize more people. Already some of the activities are going to be initiated from even the vision seminar, like the patient feeding program.
It was very early in our
That's
finding.
one of the very, we can visit patients and feed them. And they go back in their respective churches, start the feeding program. They go back in their churches and mobilize more people to come to learn on how to support someone on treatment.
Who might have that passion? That I can
And
do
who-
that.
Exactly, I can do that. And all I need is to get the basic. And that's the role, the basic will be given, the training will be given by these other members of the church, but this time from the US.
At least the first time, and then
Exactly.
they will train the trainers,
And then they will train the trainers.
and then they engage at the local
so
level.
the next step then is going to be start the training. It's generally a 24 hours training.
So we did like 4 or 6 hours, or 6 4-hour sessions, something like
That is
that.
correct. With an identified or selected curriculum or a module, I should say, depending on what had been identified as problems. Generally, it's going to be waterborne diseases, hygiene, diarrhea, and malnutrition, malaria, HIV/AIDS. Those lessons are generally are taught in an hour and a half, and you can cover a number of lessons in one day. And have a pool of church volunteers trained at the end of those that 1 week training, and they go back in their churches. First of all, they start applying lessons on their own homes, and then take those lessons into other community members' homes. Remember, we talked about 7 homes that each one is going to be responsible of to bring those lessons.
Whatever that happens to be.
Exactly.
It's interesting, you as you speak, the Vision Seminar, you may not have a bunch of solutions. There may be several ideas that come out on the boards.
Right.
But it's talking about it. It's opening up the conversation.
Right.
And as I recall, the feeding program was not something that the local clinic or anyone had come up with, really. It was the local church. They recognized that, wow, there's these patients that don't have food, or they're so sick they can't cook their own food.
Right.
And it was just one of these obvious moments. It was like, well, we can cook for them. Exactly. Absolutely.
Yeah.
Start simple. It doesn't have to be a complex solution.
Right.
For those opportunities that are more complex, we
Right.
talk about the focus acrostic and kind of going through a process.
Right.
But I think a vision seminar is really, one of the goals anyway, is to really expose potential issues, have people participate. You mentioned breaking into small groups.
Right.
We want everyone to have a chance in a room of 50, 60 people,
Right.
probably about the size we were seeing.
Right.
Break into groups of 10 so everyone can talk. These are very easy kind of learning practices.
Exactly.
But we want to go step by step. We want to be calm. We want to have time. It may even take more than one vision seminar. It's
sure.
okay.
Yeah.
But you see that light, that passion turn on in people, and they have that aha moment. Like, wow.
Exactly.
And we talked about having participatory lessons, etc.
Right.
The vision seminar is that first moment where we can all come together.
Right.
Once we've communicated all of our plans
Right.
From abroad and locally, and get together and start discussing what can the church do to improve and transform people in the community.
Exactly. And at the end, without interrupting you,
Please.
Bill, at the end of that day, that vision seminar day, so you notice that there is a certain kind of confidence and satisfaction at all levels. You have the clinic here. We felt before that the church wasn't not really helpful for anything. But at the end of that discussion, the clinic representative go back with an idea in mind that we have another partner in the community. And there were resources that were not used. These people, the church is becoming a partner in health. And the same thing for the local government leadership. They live there with another partner discovered, a partner who's strong and able to do something to support their respective efforts as far as developing the health of the population is concerned.
I would even add the church leaves there, suddenly realizing they can be a partner in health as well.
Exactly.
Yeah.
And that is the whole purpose of the vision seminar, is to, we can do this.
That's a good way to put it.
All we need is some basic, and we don't even need anything. All we need is just a reminder that, we can do this. We can feed our own patients. We can minister to those who were ignorant about how one gets infected, or one can cause harm to himself just because of the ignorance. By bringing a very brief message, we can make a huge transformation in terms of diseases prevention.
Fantastic. So as you're reviewing this video and thinking about early engagement, think about the Vision Seminar. Think about having a communication strategy. And I would just reiterate, take your time with it. It's about the relationship. It's about the journey. That moment was like, wait a second, we can do something.
Right.
Is remarkably rewarding. And I think all members of a Vision Seminar have that moment. So
Right.
thank you very much.
Not a problem. Thank you.